Ladies and gentlemen, thank you for being with us. I'm Armando F. Sanchez. I have the pleasure, the honor of having Dr. Scott Sherman. He's an MD, NYU, extremely busy. I don't know how he has the time to be here with us, but here he is with us as well. He is at Langone Health, and this is something that's everywhere. We have it here, even in San Diego, even though there's different departments. But I understand he only teaches at NYU, and he works with the Veteran Administration there. Thank you for being a guest on our show.
Thank you very much. It's a pleasure to be here.
Now, we had the pleasure of sharing a tour out in the Caribbean, and we shared the day together, and we were walking on bamboo bridges. I don't know what we were thinking, but we were doing it anyway. And we had the pleasure of meeting your wonderful wife, and then my wife, Trini, was with us as well. Spent the day on the island, and we had a chance to talk. But what caught my attention was your openness, your friendliness, and your insights about how you were able to talk about the future of the impact of AI on medicine. So let me pass that over back to you. Where are we today in terms of internet with medicine through Wi-Fi, and where are we going for the next 5 to 10 years?
I can talk about two different things. Let's with the Wi-Fi, and what I'm thinking of with that is virtual care, which has really exploded over the last 5 years, but really is a trend that started 20 years ago. And then I can also talk about a separate trend, which is artificial intelligence or AI, and how that is currently transforming medicine and where that might go in the next 5 to 10 years. How about I start with the virtual care part?
Absolutely. And I'm really curious to see how you distinguish the two because most people usually combine the two. So we'll start with the virtual side.
So, virtual care basically is a catch all term which includes a wide range of technologies that help deliver healthcare. The one that many of us think about now when we say virtual care is video telehealth. You like this became very common during the COVID pandemic,
Right.
where people didn't want to leave their house, didn't want to be around other people, and we would replace an in-person, a face-to-face visit with a video visit. So that's one part of virtual care, but there are other parts too. There is remote patient monitoring. Maybe you have a blood pressure machine at home that transmits your blood pressures wirelessly to the doctor's office, or a glucose monitor, same thing. Virtual care also includes the patient portals that many of us are used to using now to check our labs or to schedule appointments. So all of that is virtual care. This all started probably 20 years ago or more. The system that I see patients within, the Veterans Healthcare Administration, or the VA, was one of the early adopters, and they've been doing certainly remote patient monitoring for 20 plus years. But where things really changed was, as I said, the COVID pandemic. All of a sudden, going out into public was a risk, and healthcare changed quite rapidly. That video visits had this exponential peak, which increased into 2021 and then decreased mostly since then,
Mhm.
but still back above where things used to be in 2019. Essentially, the cat's out of the bag, and it's not going to go back in, because for some things, this is a better way to deliver care.
Why do you say it's better?
Well, I'm here. I see patients, and my office is in New York City, where there's a practically infinite supply of doctors, but there's also a practically infinite supply of patients needing doctors. Ironically, even in New York City, it's really hard to find a primary care doctor or a geriatrician because there's more demand than there is supply. But let's think about if you're in the many parts of the country, say rural Iowa or rural Texas. The nearest primary care doctor may be a 2 hour drive away or an hour drive away. And that's just for primary care. If you need to see a specialist, a cardiologist, or unfortunately, if you have to see an oncologist, many of the times there just are none within hours and hours. So it makes it so that you don't have good access to care. It's even more true of mental health care. So psychiatrists and psychologists, there are huge parts of the country predominantly rural, where there are essentially no psychiatrists or psychologists. So virtual care, particularly video telehealth, is a great way to balance supply and demand. If you are sitting in a rural part of the country where there's no psychologist at all, there are other parts, either within your state or other states, where there are plenty of psychologists who are happy to see somebody by video. So it's a great way to improve access to care for a large number of people.
When you say that, my mind always thinks, and you mentioned rural US, but now it sounds to me that you have a system in hand where you can reach worldwide, where even languages isn't an issue because now we have translators. So it's sort of your value just increased and the amount of people you can help has just grown.
Yes, I'm used to working within the U.S. healthcare system, but I have colleagues in other parts of the world. For my different research projects, I've been in Abu Dhabi and Tanzania and South Africa just within the last year or so. And each of those would have their own different issues with supply and demand. But as you said, there's no reason that this couldn't happen globally. What stops it from happening globally is the same thing that limits, to some extent, the ability of me in New York City to deliver care to someone in New Jersey, which is state and national laws regarding licensing. There's nothing inherently with healthcare that keeps me from seeing and providing care to a person in France or in Togo or in Singapore, other than the fact that I'm not licensed there. So that's not a technology problem. That's a political issue.
To take it to another level, teaching. You're a professor and you can teach other students who are becoming doctors worldwide as well. So the benefit is not only for individuals in the country, but everyone can benefit from your knowledge.
That's exactly right. My colleagues at NYU Langone Health, particularly in my Department of Population Health, the one that I'm in, they have programs going on right now, collaborating with colleagues in Nigeria, in Ghana, and other countries in Africa to provide medical education to both undergraduate students and graduate medical education. They do this typically in conjunction with local experts to build capacity locally. It's a great approach, and there's also, as you said, no reason that can't happen anywhere in the world at this point.
Wow. What a lucky time to be in, to have been born in this period of time and see the developments from zero to this point. It's just fantastic.
It's certainly a huge change. When my wife graduated from architecture school, she went to Italy on a trip, and got a mild injury, had to call her mother at that point to let her know. And simply making a call from Italy to the US took hours to arrange, cost back then, I think, $100, which I can't even begin to imagine would be net in today's terms. And now we take for granted that you can call by phone anywhere in the world, that you can have a video call in some ways even easier anywhere in the world. It's a huge opportunity, one that technology has radically transformed the world in that way. As people would say, the world has gotten much smaller.
Absolutely. Now, you mentioned something about looking into the future, 5 to 10 years, and you said that AI is starting to be part of the new formula.
Okay. I would guess probably 7 or 8 years ago, I was having a conversation with my brother in law, who at that point was working for IBM's Watson division, the division that includes their artificial intelligence research and development. And we were talking about AI in healthcare. And he already at that point, as did all of IBM and many tech companies, saw how this was going to radically transform medicine. And so I asked him what he meant. And he said, think about radiology or dermatology, where really both of those are simply pattern recognition. that, and pattern recognition is something that computers and AI in particular can do really well. So at that point, he and I both guessed that it was probably 5 to 10 years before a computer would be better than a doctor at looking at X-rays or looking at skin lesions, rashes, things like that. And I think we're already clearly at that point. I said 5 to 10 years because in clinical context makes a big difference. So if I just show somebody an image of an X-ray or a rash, um, that's helpful. But you also need to include what's happening with the patient. So when I order an X-ray, I always have to put down a little bit of detail about, this person has a cough or they've had a fever or what they're having trouble breathing, because that information is really important to the radiologist or to the dermatologist. And that's something that is not just pattern recognition. However, it's something that AI does really well because that's just part of the pattern. So I think we're already clearly at the point with AI programs having processed a million, a billion, many billion images where they're as good, if not better, than a live person. So that's a huge transformation. That means that there's no reason that a health system can't have their x-rays read by a radiologist sitting in India, where they might be paid only a quarter the amount that somebody in the US is, but very well by local standards. And in fact, that's happening for health systems where you have physicians who are trained in the US, but living in another country reading images like that. So in terms of transformation, that means if you are a medical student now thinking about going into radiology or dermatology, probably what you're going to be doing is procedures. So if somebody needs a ultrasound guided biopsy, the computer is very good at understanding the ultrasound, but computers at this point are not so good at putting needles into the middle of the body. They're getting better, but that's still, I think, further down the road. I know that there are robots that assist with surgery, but I'm going to skip over that separate answer about that part. But I also pushed back on my brother-in-law, said, I'm a primary care doctor. A lot of what I do is relationships and talking with people, understanding not just what they say, but what they don't say and what their body language tells me. And I don't see computers replacing that, even with AI, for quite a while. And he agreed. He said, "You're absolutely right. There's all this part that goes into communication, which is nuanced and cultural and really difficult and takes years of practice. And some people do it really, really well." He said, but at the same time, when you're talking with the patient 5, 10 years down the road, there probably will be a little screen over on the side where it's listening, and it may say, don't forget to think about these unusual diagnoses that fit what the person is saying, but you might not normally remember, which is great. I welcome that when that comes as a way to help provide better care for people. I still would have to put it into context with the patient, with their values and their preferences, but more support like that is always great. In the short term, a simple way that this is transforming practices and saving people some time is AI assistants are there and they're in the room listening with people's knowledge and permission, of course. And then they write the doctor's note for them. And the doctor reviews it, and because they heard the whole thing, easy enough to turn that into a note. And it's much quicker for the doctor to just edit and review that rather than to type it from scratch or to handwrite it from scratch. So I guess one more thing is diagnostic ability. So I gave the example of dermatology and radiology, but when they give computers difficult problems now, so the New England Journal of Medicine, arguably the leading journal of medicine in the world, every week publishes their clinical pathological conference. It's sort of a medical mystery. And this is a big tradition in medicine to review these and to try and figure out what's going on here. It's often either an unusual condition or sometimes it's an unusual presentation of a common condition. but they're always challenging.
They're
And
looking at
at this point, AI programs do better than live doctors, because this is also the fact that it's a puzzle and esoteric gives them an advantage because they have can review all the world's literature in a way that is beyond the scope of people.
I'm going to push the envelope a little bit more on this area. You're going 5 to 10 years, 20 to 50 years.
Oh, that's so hard. We need a futurist in the room here. That
Oh,
you know,
from the another perspective to ask the same question and see if it says it. What would you like to see in the future, given the technology we have today? Now, there may be new additions, which there probably will, but would you like to direct where AI will go over the next long-term future?
I mean, AI both excites me and scares me. And I was a computer programmer for 5 years, so I'm not unfamiliar with computers and what goes into it. We've Many of us have read science fiction novels or seen television movies about the dystopian side of AI, ones where the computers decide that the world would be much more efficient, much better if there weren't humans in it. There'd be less pollution, there'd be less of all these different things. Of course, there'd be no people. And that is always scary, that we're really good at inventing things, but as a society, and I would say particularly the US, we're not so good at making value judgments and societal decisions about what do we want? What's the world that we want? What limits should we put on AI? Even the tech companies have said that there really should be limits, and we've moved towards a direction where right now nobody's making the rules, and that's not a good situation. So that scares me, and I think scares many other people who are much more familiar with computers and AI, in part to look ahead at where might we be 30 to 50 years. I start by looking backwards 30 to 50 years. 50 years is easy. That was computers were really first developed around then. Officially you could go back to the 60s and go back even further. But practically speaking, when I was a high school student in 1975, I actually learned computer programming with BASIC in my high school, and it was on a long paper tape, and you had to go to a big room, a terminal, to access this huge computer that took up like an entire room somewhere. And then we moved forward to the 80s, where I was in college and initially was doing stuff on punch cards and again accessing it through a terminal. By the time I got to medical school, my mother-in-law had bought an early computer that was really sophisticated because it would store 10 kilobytes of data, uh, which is so little that we can't even think about it now compared to terabytes and things like that. So that's only going back 40 years. And then the 90s, we really first had access to the internet, cell phones, same thing. The world has changed so much in the last 30 to 40 years. So we don't know what we don't know. So it's hard to know what technology is going to come down to the road. On the computer side, we had things driven by what was called Moore's law, that computing power would double, and the cost of storage would reduce by half.
Right.
And we've seen how that has played out. And it means that like my device right here is as powerful as a big desktop computer probably only 5 years ago, let
Wow.
alone looking. And so when we extrapolate that 10 years down the road, it's going to be hugely impressive things. I think clearly a challenge that we face as a society is, what is the role of people going to be? We're already seeing tensions with that across the US, where people have been replaced by technology over the last 20 years, and that's led to huge disruption and a need to change our workforce. But I think when we look 30 years ahead, not only does that trend go far, far faster, if computer can replace a radiologist, a highly skilled person, it can replace a lawyer, an accountant, a machine worker, anybody. And then we get to the issue of, well, what should people be doing? Do we need people? What do we want people to be doing? How do people make an income? It profound changes to the structure of society, which again, we're not so good at thinking about what do we want. And this is going to be some really major issues confronting all of us. So I won't be around most likely. I'll be here. I hope to be here 30 years in the future, but I highly doubt that I'll be here 50 years in the future. I'm always fascinated by technology, but it's also fascinating that the way that it has shaped society and changed everything. So I didn't really give you an answer because I'm
Oh
not so
no,
good.
you did in many ways, and what you made me think very quickly is the idea that uh, maybe in the next 30 years, you have family in IBM, maybe they'll download all of your mind information, and then I can go to a virtual doctor that's actually you, but you're not physically there, but you know where I'm going with all this. I do have one final closing question for you. What is your advice to up and coming doctors worldwide in order for them to be successful given this new world of AI, virtual reality, etc.?
I think new doctors are already very immersed in it. Incredibly different from than when I went to medical school. When I was first a faculty at UCLA in the 1990s, or doctors were not great with computers and with technology, and we had to orient them because we were early adopters, having created an electronic health record where I was in the mid 90s, at a time when nobody really was using them. And it was, you could see right away during the orientation how comfortable that doctor, he or she, was with technology. Some got it right away, and some you could explain it a dozen times and they still didn't get it. That, of course, has changed. There's nobody going to medical school is unfamiliar with technology in the US now, and I would guess around the world. That it's changed the delivery of teaching, not just during COVID, where many things were virtual. But if I think about learning anatomy, I spent like 6 months in a lab every day dissecting a cadaver. This is what everybody had done in medicine for the last 200 years. But in some ways, it's even easier to learn that now with virtual reality and with 3D imaging. You can rotate things and learn things in ways that I couldn't really do. So that's huge. And that, of course, will only continue. We touched briefly on robots and robot assisted surgery. That is a reality now. It's been a reality for 5 to 10 years. One of the senior researchers, I mentored him years ago, and he's now quite senior and super accomplished as a urologist. And early on, he published papers showing that the quality of care with robotic surgery was not one bit better than with a human surgery. However, if you looked at all of the medical centers, the ones that had robots featured them prominently because this was marketing for them. It was a $2 million investment. They wanted to show that they were cutting edge, even though it wasn't really cutting edge. It was uh, just another way to do the same procedure. But of course, if we look forward 10 years down the road, I'm sure that will not be true. I'm sure at that point, robotic surgery or robotic assisted surgery will be easier and better than human assisted surgery. So nobody would think about going into one of those fields without learning how to do that. And all the training programs will be teaching that. In the same way that when I was a fellow, I learned how to do sigmoidoscopies, which is like a short version of a colonoscopy. And ultimately, it's kind of like playing a video game. You're moving
The
this thing
patient is there
around.
and you're playing video games. Wait a minute.
Yeah, no, I'm not like shooting aliens inside somebody's intestines. But at the same time, I am manipulating knobs, which changes an image in 3 dimensions, and looking at it on a screen while I do that, which is essentially what you do in a video game. So that part will not be all that unfamiliar to most medical students, where whether they're male, female, US, European, African, many of them have played video games before. And so technology is shaping our lives, including both for fun and for work. And it will, I think people training and healthcare changes, people are changing too because they're exposed to it everywhere.
So, if I can extract from what you said, so as you're going and probing this short part of colonoscopy, you could have 20,000 students behind you watching you do this because of the use of AI and virtual reality and the internet. So the number of people that can be educated just grows exponentially. And I see that already to be a massive thing.
Yeah, and I would say to take it a bit further, not only could they be watching, but the computer might also be driving to the point where it might say, "Oh, don't forget you missed a little spot on the right." Okay, if I take a look there, and then it turns around and looks at the spot on the right. Uh, that's a pretty straightforward use of technology. Or might look and say, "Oh, you don't need to biopsy that one. That one very clearly is an X. We know that that's not going to cause any problems."
Amazing times. Thank you very much for being on a guest on our show, and I have to thank you and all the other persons in your field for going through the pandemic, bringing us out of it, and more importantly, I think I'm 73. I
Oh,
don't think
you're
I could
still
have
young.
reached. I don't think I could have reached this point if it hadn't been for all the modern medicine and research and work that you've done. So heroes don't all come in white shirts in offices. It's also people that work around the world. And I know you have many projects that you reach out on the level of smoking and other fields of cancer, etc. So I don't know when you sleep, but that's a whole different story. But thank you very much, Doctor, for being here with us.
Thank you very much, and best wishes to you and to your wife as well.
Thank you very much. I hope to have you back, and you're always have an open door. But thank you for letting us look into the future through your mind. And there's a lot to think about. Like you say, there's a huge amount of benefit, but there also is areas of ethics and dangers that we have to look at as well. Thank you for
Absolutely.
pointing them out for us. Thank you very much. And good trips, and hope to run into you somewhere else.
Yes, likewise.